The humble face mask has become the defining image of this coronavirus outbreak. Up to now, it's acted as a barrier to transmission. Now though, thanks to experts at the University of Leicester, it could help detect whether someone's been infected. How excited are you about the potential of this mask?
Very excited indeed. If it performs as it has done in other areas, it could be potentially transformative.
Scientists have adapted the mask with two strips, which trap the microbes someone breathes out. After about half an hour, the team have enough of a sample to analyse. This is a demonstration, but under laboratory-safe conditions, it may be possible to test for traces of the virus and diagnose someone with the illness before they start showing symptoms. Now, the mask may not just detect the presence of the virus, it may potentially detect just how much somebody is breathing out. So if I put it on and it measures how much I'm breathing out now, it could find out if somebody is a super spreader, so to speak, somebody who's breathing out a lot of the virus, and that could help health officials target more effectively their measures to prevent the spread of the infection. The key question, of course, that everybody asks in these situations is how soon could it be available in mass production?
It depends on our resources. In principle, within a month or two, I think we need to do a lot of testing first. So I think if it's shown to work, something like 6 months before it could be widely available.
If they prove effective, it's a win-win for the NHS. A way of screening for the virus and a technique which costs pennies. Peter Bean, ITV News, Leicester.